I'm Brian Videan. I worked in the operating room for most of my career, and then I started working here in January of 2023, providing interventional pain services to the patients in the Hillsdale community. I've always strived to work in small hospitals. I like to treat the underserved. The part of the anesthesia side of things I enjoyed was actually performing blocks on patients prior to surgery and then having them wake up and not have any pain, because I was able to skillfully put medicines on nerves and turn off the pain signals that they would have after surgery. So then the next step was interventional pain management, which allows me to advance the procedures that I do more skillfully, and also using different equipment, live x-ray. From a very early age, I had scoliosis as a kid and was going to a chiropractor, and I've dealt with a bad back better part of 40 years. And so I have that ability to relate and to be able to draw out. I can ask them questions based on my own experience. Does it feel like this? That's my approach. You are me. I am taking care of myself and how I want to be treated. And so the patients seem to respond quite well to that they can relate to things a little bit better with me, because we have that shared experience, knowing that the person who's going to provide that care to them has been through it, knows what it feels like, and is going to do everything he can to make it more comfortable for them. Because some of the procedures we do can have a pinch to them. We're dealing in needles many times, and I pride myself in trying to provide a patient a service as pain-free as possible, so they tell as many people as they can that it's not as bad as you would think. My favorite thing to treat is arthritis, and particularly in the back, because that was something that I personally, again, dealt with for many years and didn't think that there was something available to treat that. We are not going to do anything without telling you first, without explaining it thoroughly. And then we're going to do our best to make sure that we do an excellent job of local anesthetic, because our patients are awake for our procedures in most cases, and they don't want to have a bad memory, and I don't want them to have a bad memory. The name of the business is a pain clinic, and that can be kind of intimidating for people, right? I want you to know that we take great pride and care in making sure that when we're going to perform a procedure on you, you're going to have the best experience you possibly can.